Good afternoon, everyone. A very warm welcome to Liver Cancer Awareness Series organized by Voice of Healthcare in collaboration with Isai Pharmaceuticals. And in today's session, we'll discuss about decoding liver cancer, its early warning signs, and some modern treatment approaches. I'm Dr. Muskan Ahlawat, and I will be leading today's discussion. I hope we will have a wonderful participation from all of you who care about understanding one of the most vital organs of our body. So, liver health is often overlooked until the serious problem arises. The liver quietly performs over 500 functions from detoxifying harmful substances to producing essential proteins and supporting metabolism. But unfortunately, conditions like hepatitis, fatty liver disease, and cirrhosis can progress silently. Sometimes even they lead to liver cancer. So, by understanding the early signs, some risk factors, and treatment options, we can take proactive steps to protect liver health and improve survival and quality of life. It is my privilege to welcome our today's guest speaker, Dr. Rahul Pathade, consultant medical oncologist at Sahyadri Hospital, Pune. Dr. Rahul will help us understand the underlying causes, warning signs, and latest advancements in liver cancer. Hello, sir. A very warm welcome to you.
Hello, thank you so much. Good afternoon, everyone. I'm Dr. Rahul Pathade. I'm a consultant medical oncologist at Sahyadri Hospital, in Pune. So today we are here to talk about the liver cancer. As we know that liver cancers, the number of liver cancers they are increasing day by day. So we are here to discuss about the liver cancer. What are the signs, symptoms, how to diagnose liver cancer, and what all treatment options are there for a liver cancer.
Thank you so much, sir, for joining us here today. So, Dr. Rahul, to begin with, we would like to understand what is liver cancer and what are some major causes of liver cancer.
Okay, so basically, as per the Globocare 2022 data, liver cancer is the eighth amongst all cancer in the world, and it is the sixth most common cancer in India, as per Cancer Registry of in India. And hepatocellular carcinoma, it is the most common cancer of an liver, which is around 80% of an all liver malignancies. And the most common cause of a liver most of the liver cancers, around 80% of a liver cancer, they are also associated with the cirrhosis of the liver. And the most common causative reason behind this cirrhosis is viral infections such as hepatitis B and hepatitis C. Because of the viral infection, there's a repeated trauma to the liver parenchyma, and there's an inflammation, and there's a mutation of a normal cells, and over a period of time, persistent infection causes changes in the liver parenchymal tissues, and it lead to the cancer formation, which is a hepatocellular carcinoma. It is usually seen in ages of 60 years of 60 and above years of an age, and male being a most common gender for the hepatocellular carcinoma. And other causes of an hepatocellular carcinoma are like alcohol, diabetes, obesity, and lifestyle, such as a sedentary lifestyle. And some toxins such as the aflatoxin, which is a fungal, which is a toxin produced by the fungal in contaminated corns or millets.
Thank you, sir, for explaining that. You were mentioning about alcohol, and my next question is related to that. That many people assume that liver damage only happens after years of alcohol use. But in your experience, how would you suggest that lifestyle factors like we are having a hub of population going through obesity, diabetes, or hypertension, can these factors also contribute to liver cancer?
Yes, there are studies which shows diabetes, obesity. They do, prone for the development of an hepatocellular carcinoma. But most common, factors which lead to the formation of an hepatocellular carcinoma, majorly alcohol and such as tobacco smoking. So, in patients who are consuming alcohol for a long time, so there is an increased risk of an development of an hepatocellular carcinoma, almost twofold compared to the general population. So yes, because of the alcohol consumption, diabetes, and obesity, there is a such there is a fat deposition in the liver, and the repeated fat deposition lead to the inflammation, and it lead to the formation of an hepatocellular carcinoma. So yes, alcohol consumption, diabetes, they do they are the risk factors for the development of an hepatocellular carcinoma, along with viral hepatitis. And they are not only the risk factor; they act synergistically with the viral infection for the formation of an hepatocellular carcinoma. So the patients who are consuming alcohol, or they are tobacco chewer or the smoker, and if they have a viral hepatitis, so both of them act together and lead to the hepatocellular carcinoma.
So, sir, as you were mentioning about lifestyle habits, so my point is to you is that what lifestyle habit should we follow that we should protect our liver from such kind of diseases or cancer?
Yes. So, as I mentioned before, obesity is one of the cause for the development of hepatocellular carcinoma, and alcohol and the smoking. So, one should avoid, a lot of consumption of an alcohol and smoking. And we should have a, green leafy vegetables, which diet full of antioxidants, vitamin E. They do help in, avoiding the development of an risk of an hepatocellular carcinoma. And in some retrospective studies, it has been seen that consumption of an coffee may reduce the risk of an development of an hepatocellular carcinoma, as it is rich in antioxidant.
Thank you, sir, for such great practical tips that one should follow. So, moving onwards, as we have, discussed about basis of liver cancer, we would like to know something about its diagnosis part also. So, sir, how crucial is diagnosis in liver cancer management, and what are the screening methods available nowadays?
As per the guidelines, the standard there is no standard screening test available,
Mhm.
but definitely in high risk populations, such as the patients who has a alcoholic cirrhosis or non-alcoholic cirrhosis because of the viral hepatitis, such as the hepatitis B and hepatitis C infection, they should be screened along with the ultrasonography and alpha fetoprotein. Uh, Alpha fetoprotein, it is a glycoprotein which is produced by the liver, usually in the embryonal stage. But when there is a trauma to the liver parenchyma, so in hepatocellular carcinoma, there is a secretion of an alpha fetoprotein which can be used in the screening method along with ultrasonography to diagnose a hepatocellular carcinoma in early stage. So the high risk populations, as I mentioned before, with the active viral hepatitis and the chronic or cirrhotic patients, they should screen with ultrasonography of an abdomen along with alpha fetoprotein. And if alpha feto, there is some nodule more than 1 centimeter on ultrasonography with contrast enhancements, then that should be thoroughly investigated, and the standard investigation diagnostic modality would be triphasic CT scan, which has an arterial, venous, and portal phase, or MRI of the liver. So on these diagnostic scans, we can find out the characterization of the liver nodule on CT, contrast enhanced CT, triphasic CT, or MRI. Most of the nodules which are which goes in the direction of an hepatocellular carcinoma, they are with the hyper enhancement of the nodule in the arterial phase, with the washout of the contrast in portovenous phase, and there is a capsular enhancement. So the patient who are having a nodules which is more than 1 centimeter, with the raised alpha fetoprotein, and with the characterization of an hepatocellular carcinoma, should undergo biopsy. We can avoid a biopsy if that diagnostic feature is very classical of an hepatocellular carcinoma, and around 20 to 30 percent patient only shows the raised alpha fetoprotein. So biopsy does help us in a final histopathological confirmation of an hepatocellular carcinoma. And there's another serum marker which is a puca. which can be used for while diagnosing the hepatocellular carcinoma. Although the sensitivity of an alpha fetoprotein is around 80 to 85%, with the specificity of it goes till 95% if the range of the alpha fetoprotein is more than 400 nanogram per ml.
Thank you, sir,
So
for explaining. Sorry to cut you. You were mentioning
yes,
something?
so these are the diagnostic modality, and the most of the hepatocellular carcinoma, they are asymptomatic, and they develop symptoms in advanced stage, such as the pain in the right hypochondrial region, weight loss, or jaundice. So most of the liver lesions, they get diagnosed in a later part of disease, later stage of the disease.
Sir, thank you so much for explaining so much of diagnostic facilities that are available. I had a doubt that when should a person go under screening? Is there any particular age or any particular symptom that we see in our body, and then we should go for liver screening?
Yes. So the patient who has a active hepatitis B and who are a chronic patient of the viral hepatitis, either hepatitis B or hepatitis C, they should undergo screening. Or a patient who is a chronic alcoholic and suddenly develops a weight loss, abdominal pain, or fullness, they can be screened for the HCC. And most of the patients who develop hepatitis carcinoma, they are elderly males. So the elderly males with one of the risk factor, or the patients, but the patients with the congenital glycogen storage disorder, they should be screened because they are at higher risk of an development of an hepatocellular carcinoma, such as porphyria cutanea tarda, or hemochromatosis. These are the patients with hereditary deformities. They are prone for development of an hepatocellular carcinoma. So these are the patients who has this congenital anomalies, chronic alcoholic patient, and patient with a chronic viral hepatitis. They should be screened. Apart from the normal patients who develop a kind of symptoms, and on ultrasonography you found to have some nodule, they should be thoroughly investigated with either of the risk factor.
Thank you, sir, for answering that. So, moving ahead, can you explain some most promising new treatments that are available worldwide for liver cancer?
So, if you see the treatment of an hepatitis carcinoma, so the 5-year overall survival is around 20 to 25%. But within a last decade, with the development of an immunotherapy, the survival has increased. So, with the development of an immunotherapy and targeted therapy agents such as atezolizumab, with bevacizumab, so we can extend the life of the patient with the stage 4 disease of an hepatitis carcinoma. It increases the overall survival, almost 6 to 8 months with this treatment. So we have a tremelimumab plus durvalumab, and we have a lenvatinib also, which do help patient to prolong their life, to decrease the symptoms such as the pain, weight loss, uh, and other the disease related symptoms. So with the advancement and development of these molecules, immunotherapy, chemotherapy, so there is a shift in a survival of the patients with the hepatocellular carcinoma patient. So we have a now we have a ablation therapies also. We have a liver transplant in early stages of the liver cancer. So we can go ahead with the TACE, transarterial chemoembolization, or transarterial embolization. Then we can go ahead with the radiotherapy. So we have a development of an high-end radiation technologies such as the stereotactic body radiotherapy. So in which what we can do, the we can shrink the tumor with the help of the radiation, and we can give a high dose of an radiation, and with avoiding the normal tissue damage. Because most of the as I said before, the 80% of an all hepatocellular carcinoma, they are associated with the cirrhotic liver. So the normal parenchyma, we need to save, we need to protect from the radiation part. So we have a stereotactic body radiotherapy which delivers the high dose of the radiation to the specifically to the tumor, targeting only to the tumor, avoiding the radiation injury to the normal liver parenchyma. So we have a SBRT, we have a immunotherapy, we have a lenvatinib, and we have a liver transplant. So there's a paradigm shift in the treatment of the hepatocellular carcinoma. Initially thought to be having a hepatocellular carcinoma is a it's a life sentence is changed in the past decade, as we have this immunotherapy, radiotherapy, and transplant facilities along with the ablation. So, and the patients who underwent a transplant and then again, suppose they are developing a hepatocellular carcinoma, in those cases also we can go ahead with the radiation, avoiding the tissue injury to the transplanted liver, and we can salvage the transplanted liver with the therapy, with the help of an radiation, with lenvatinib. So that is the case now. We can even in the patient who underwent a transplant for hepatocellular carcinoma in early stages, and later if he develops a re-hepatocellular carcinoma in the same transplanted liver, in those patients also we can do a salvage treatment such as the radiotherapy, or else targeted chemotherapy, such as we can give a ramucirumab, we can give lenvatinib. So treatment options are widely available, not only in the patients with the advanced hepatocellular carcinoma, but also in the patients who underwent a transplant for the early stage of an hepatocellular carcinoma, and they again develop a hepatocellular carcinoma.
Thank you, Dr. Rahul, for explaining so much about innovative treatment options that are available. Sir, you were mentioning a point about reoccurrence. Sir, I just wanted to ask a question that if someone has gone through, radiation or immunotherapy or liver transplant, so how much is the percentage chance of reoccurrence for that patient? Or if
So
he or she avoids lifestyle factors like alcohol or dietary habits, so can we protect that?
Uh, basically, it all depends on the early stage of an cancer patient's general fitness and what all comorbidities patient has. So we have seen one patient who underwent a transplant in almost 7 8 years back, and now he developed a single nodule in the transplanted liver. So around 30 to 40% patient they do recur, even after transplant. And the patients who underwent immunotherapy or radiotherapy, they do progress after some time if it is in an advanced stage.
Okay. Thank you so much, Dr. Rahul. Sir, in your vast experience of medical oncology, and you must have diagnosed, patients at early stage or advanced stage, particularly for patients who are diagnosed at advanced stage, what steps can, help improve their quality of life, caregivers or their family members? What should they
The
do?
first of all, breaking the news is a very difficult task when patient first come to the OPD, and we have to tell them ki, yeah, you are diagnosed with such an like hepatocellular carcinoma which is in a stage 4. So with sympathy and empathy we can break that news, taking patient and his or her relative into consideration. So psychological support, yes, we need to give a lot of support. We need to counsel the patient that it's not the end of the life. So we have different treatment options are available, and with the treatment we can improve his or her quality of life. Suppose patient having a pain, so we can give a pain medication. And suppose patient is having a ascites, or there's a pedal edema, there's a deranged liver function test are there also. So we can use a gastrointestinologist to help, and to give the medication, to give a symptomatic relief to the patient's symptoms. And definitely we need to take a help of a psychiatrist also, if at all patient goes into the clinical depression, or he's thinking too much and negative about the diagnosis. So it is a the cancer treatment, it's not a single modality treatment. It involves everyone. It involves the surgical oncologist, it involves the radiation oncologist, medical oncologist, pain and palliation, and general physician too. So looking at patients' general condition, his symptoms, his age, and his body requirement plus disease status, we can take a call whether patient need gastrointestinologist help or radiation help or pain palliation help. Because if patient is in a terminal stage of the disease, so pain and palliative department is very helpful in the terminal care of the patient, giving a symptomatic relief to the patient, and giving and including a dietitian, because diet modification will definitely help the patient for the better quality of life.
I agree, sir. I think it is a very compassionate approach that one should follow. It is a teamwork
Yes,
of patient, its family, and doctors as well. So, sir,
exactly.
as we are
Very true.
progressing towards end of our discussion, so let's have a quick myth versus fact segment where we'll address some misconceptions about liver health. So my first
Yes.
to you would be that I think you answer most of it. That once liver cancer is diagnosed, many of us think that treatment options are very limited. But
No, they are not limited, at least now, because we have a lot of options such as the surgical oncology options, liver transplant, we have a live donor, cadaveric donor. Then we have a interventional radiology help. We can take we can do a ablation, which can be radio wave ablation or a chemo ablation, or else, if feasible, then we can go ahead with the radiation oncologist help with high-end technologies such as SBRT, and definitely a medical oncologist who can prescribe immunotherapy or lenvatinib and other molecules which are available. So no, it's not like which was there initially. Now we have a lot of options in the hepatocellular carcinoma in advanced stage too.
moving ahead, sir. Second is it is very common nowadays that we have so much of herbal drinks, detox drinks, or some supplements that are available, and they claim to cleanse our liver health naturally. So should we take that, or they are just for
Uh,
branding or something?
No, there is no level one evidence which supports that this particular kind of drink will help you, to prevent hepatocellular carcinoma. Except for antioxidants, they do help. And coffee, as I said before, it is clinically tested that consumption of in coffee may help to prevent hepatocellular carcinoma. But then again, we one has to be take this with a pinch of very carefully, because there are limited study which supports that this particular kind of intervention will prevent hepatocellular carcinoma. So whatever comes on the media, it's not based with the level of evidence which will support that this particular kind of drink or tablet or some particular intake of some particular natural or ayurvedic drink will help you to prevent the hepatocellular carcinoma.
Thank you, sir, for clarifying these myths. And I think it is very crucial to separate such kind of myths from medical facts.
Yes.
So, sir, my last question to you before ending would be any practical tip that you would like to give to our audience for following their in whole life for their better liver health.
So, as I said before, the sedentary lifestyle, may lead to a development of hepatocellular carcinoma. One should, have a, increase the physical activity will lead to a healthy lifestyle, avoiding a lot of consumption of an alcohol and avoiding, smoking, quit smoking, and having a, fresh green leafy vegetables and diet with rich of antioxidants definitely will help one to have a healthy lifestyle, healthy life.
Thank you so much, Dr. Rahul, for sharing your knowledgeable and valuable insights with us. I hope audience will find it very useful. Thank you so much, sir.
Thank you so much. Thank you, viewers team, for giving me this opportunity to talk about the liver cancers. Thank you so much.
Thank you so much, sir.
Thank you.